Hi, everybody. This is Dr. Melinda Austin with Ahimsa Wildlife Medicine and Rehabilitation. We're here today to do a little CE about a bobcat neonate that we rehabilitated in the past. We are here to get excited for the upcoming baby season with rehabilitation. And forgive me if this is not perfect. This is only my second go through. I'm in my car, so it's okay. We're going to put it on YouTube and see what happens. So if you're using this as volunteer time, it's going to count for 1 hour. Please send me 3 things at the end, questions or comments regarding your thoughts on bobcats or this presentation or anything vet med related or wildlife related, and we'll get you that credit. So let's go ahead and get started with our PowerPoint here. So Echo, the Bobcat Neonate Rehabilitation, a case study. This was all done by myself and some contributing people that we'll kind of get through as we chat. And permission must be obtained through any of this because it's all been photos taken by myself and etc. So please do ask. On presentation, Echo was taken to a veterinarian after someone was hiking and his dog went off trail and came back with his kitten in his mouth. So here's a photo of that person holding the cat. And you can see that he is quite feisty and he's out in the wilderness here. So this was fall of 2020. He took the cat to his regular vet. They did a physical exam. The cat was underweight and dehydrated, coming in about 1.8 pounds. And we know in vet med that domestic kittens grow about 1 pound per month. So 1 month, 4 weeks old, 1 pound. And this cat is about double that size. So we are thinking, okay, this is not a normal house cat. Plus, it has a bobbed tail with a black tip, and it was found out in the wilderness. So we guess the age to be approximately 4 weeks old. The veterinarian at the time, it was not me, was gave some sub-Q fluids, pretty much always a good selection there. Began some oral food, dewormed, also a good idea. We do this with all of our young animal patients. And that was repeated again in a couple weeks. And they also gave a convenient injection as an antibiotic that lasts about 2 weeks. I suspect that was for a skin infection, which we're going to circle back to later, but I did not actually talk to that veterinarian, so I'm not sure. This is the best field ever, guys, okay? So why is it so great to be in animal medicine? We are learning all the time. So fun. And so please do let me know if you're interested in any mentorship or questions, things like that, and I would love to help out. So the best thing here, I didn't wake up and know I was going to have a bobcat coming to see me. So I got started with a healthcare plan. Panleukopenia vaccine, 6, 8, and 10 weeks old. Rabies vaccine at 16 weeks old. Went ahead and researched a diet recommended for raised in captivity felines. Kitten replacement milk. There's a body weight there and how often. And we should start solids by 4 weeks. So we want to make sure we're offering those at this time as we are probably that age. And we also want to transition the formula from a bottle into a bowl, allowing them to start to learn to self-feed. We're also going to introduce deceased baby animals because that's normal for them. Mom will go hunting, she'll bring things back to the den. They may be eaten or left for later. And so that's very normal. We need him to get used to that. So here's a photo of him his first few days with me and looking very skinny, very scared, poor, dull coat. We'll kind of touch on all of that here today. So for shelter, what do we do? What do we keep a bobcat in? The National Wildlife Rehabilitation Association has standard minimum requirements for each species. So for bobcats, young, I can't remember what the age cutoff is, but for juveniles, it was 3 feet by 3 feet by 3 feet. And then it gets larger to 8 by 8 by 6 for adults. And we should really have large branches, some logs, maybe some hollow logs, climbing, high platforms, and then boxes and barrels to hide in as well. So a few more days in, he's looking a little more curious and comfortable in this photo, and he's up on a several foot tall platform here. For release criteria, how the heck long am I going to have this bobcat? So they need to be a proficient hunter. That's one of the main things. And that is going to show up about 6 months of age. So everyone's going to get scored on that. And he also needs to be afraid of humans. We cannot have any imprinting. We cannot have him approaching any humans in the wild. Around 6 weeks old, he showed decreased interest in his bottle. Great. He also became more interested in dead baby squirrels that were provided. Awesome. We began offering small amounts of canned wet food. So this is not something he's going to find naturally in the wild to eat. However, he's dehydrated, he's underweight, so it's going to be good for both of those things, as well as it's expensive, it's time consuming. It's hard to rehab a large cat. We wanted to work on jumping behaviors right away, get him used to that kind of thing. So I'm going to play this video here for you. The thing I like about this video, here we go. I like a couple things. So I'm not involved as the human. So he gets to play with this object and it's not associated with positive feelings towards me. It's kind of stuck in the wall there. He has a moving target. He's using his back legs to jump and stabilize, getting those muscles to grow. And he's learning how to jump and bat at moving things. So those are excellent things for him to learn at this point. At 8 weeks old, we dropped the bottle feedings to about twice a day, and he began eating solids. Again, canned chicken and tuna may or may not be something he's eating in the wild, but it's at least a meat and a protein source. He had a bald tail, so we applied Revolution Plus, which is a topical, in case he had any mites or parasites that might be contributing to that. I offered him kibble just to fill his day with extra calories. He had no interest at all. Continued to offer deceased baby squirrel carcasses. He was for sure interested. He's smelling on them, he's rubbing on them. Very, very interested. And for those of you who are wondering, this was after the derecho in Iowa. So unfortunately, I had a lot of deceased baby squirrel carcasses that I had frozen. So the world kind of came together on that one, and Echo had plenty to eat. So that was an interesting time. He also started his stalking behavior. So if I was out in the garage with him, he was given free reign of this garage with the door shut, obviously. And he would either stalk me or he would see some feather blowing on the floor and he would go after that. So he was doing great with hiding and playing. Speaking of playing, at 9 weeks old, we started with Mama Lion Suit. So a lot of rehabbers will go to different lengths or have different opinions on imprinting and whatnot. I did the best I could as a single bobcat with no litter mates and no mom to show him what to do. So in this suit, no skin was showing. I had a ski mask, a hat covered, gloves, tennis shoes, and then I would, not be wearing anything scented, no perfume, no lotion or anything like that. And definitely he would not get food associated with this outfit or anything like that. So this was just for playing. I would roughhouse with him on the ground, teach him wrestling or batting at my hand, chasing, running away, retreating, all of those activities. So we would do that for about an hour per day or so. And he also began eating deceased baby bunnies at this time. So he was really maturing. 9/23/20, he had a vet visit for his bald tail. It was not improving and the topical had not helped. So we took him to the vet and we did an impression smear. It was a little bit infected, but just with some white blood cells and intracellular bacteria. So his body was doing its own job trying to clean that up. And so when we got to the vet and we took his towel off of his enclosure, he was growling, hissing, lunging, biting. He was so mad to be there. I was ecstatic. Yay, he's wild. He hates humans. He's nervous. He's scared. He looks vicious. Perfect. So veterinarians are pretty used to dealing with fractious cats. So We got it done, but he was not pleased about it, and I was super stoked. So he weighed about 3.2 pounds. He was really growing like a weed, and that confirmed his age a little bit. So that was a good overall experience, and we luckily only had to do it one time. A couple of weeks later, he's eating full deceased squirrel carcasses, and he's still not interested in kibble. 12 weeks old, he's starting to look a little bit meaner there. He upgraded to a 15-foot enclosure, so above and beyond what was necessary to rehab an adult bobcat. Eating canned wet food, shredded meat chunks, and deceased whole prey. If I had a patient pass away or something like a rabbit or a squirrel or a bird, he would get that carcass. So anytime he was fed and he saw me, I would have to play an air horn sound on my phone, get him to flee, scary, and I use different sounds and effects to get him to flee from me. He hated my husband, so that was awesome to see because I know he was scared of other humans and he could be aggressive, but he would mostly hide. My husband hardly ever saw him, so I'm very thankful for his partnership in getting Echo successfully scared of humans. I also would work on a light cycle at this time. During the day, he had lights on, during the night, lights off. He also had a natural light coming through a window. We would keep that window or the garage door open for sometimes to expose him to noises outside, whether that's traffic, birds, pets, things like that. At 16 weeks, he got vaccinated for FERCP and rabies. I continued to do my due diligence. I consulted with a zookeeper and a large feline sanctuary caretaker. Work smarter, not harder. We were talking about diet and enrichment options and just confirming that I was doing everything I could for him. And they recommended adding like scrambled eggs, partially cooked, crush the shell, treat puzzles for enrichment to encourage foraging skills, digging, lifting things up, going around things, etc., and continue to create that scary environment around humans. For enrichment, here you'll see a photograph of a raw deer leg, but we it was hunting season, so we had lots of deer at our availability, and so I gave him a raw deer liver. I would throw my dog's blanket in there from time to time, some leftovers from our household, pumpkin. It was also pheasant season, so he could get a little bit of cooked pheasant to start and then later progress to raw meat. Lots and lots of deer meat. This is a whole leg that my brother-in-law brought me, which was awesome. And I would hide that in a bucket so he'd have to get it out. You can also tell he's looking a little more pudgy here, putting the weight on. And there were times when, they build these beautiful beds and nests with the straw and the blankets and everything. And I would just go in and mess it up. That way it leaves my scent. He has to redo it, gives him something to work on. On the left here, you'll see a pheasant that was deceased probably that day. Raw whole pheasant before, and then on the right afterwards, he completely plucked that thing. Feathers everywhere. He also got a box of nitrile gloves and pulled it through the enclosure. So he had a fun day that time. We also used a mirror, some straw bedding. He got our Christmas tree, live fish. Those are all great enrichment options. Unfortunately, we did have to progress to live prey. So I had to purchase live feeder rats that are bred to feed out snakes and things. And it's super controversial. Obviously that animal does go through a small amount of pain while he is hunting. And so that is unfortunate, but it is necessary to make sure he's a successful hunter for his release. Around 6 months old, I started shifting with him, so there was no contact ever. So he would go into his enclosure and I would close the door. If I let him out, I would go in and close the door behind me. So he could never ever have contact with me. And this was as much for his benefit to not have contact with me as much as he had very large teeth and claws. And, I know he's just a young cat, but I take that very seriously. In March of 2021, he transitioned to an outdoor enclosure to acclimate to temperature. He was getting more frequent live prey a few times per week, and I completed an additional large cat rehabilitation training just to make sure I had everything checked off my list for release. They recommended releasing around 7 months old or more with a minimum weight, and they must be able to catch live prey. So those were the goals I continued to set for him. In April of 2021, he was successfully released. Here's his photo just before. He's looking much more mature here, of course, and I do have that video that you can reference on my YouTube. I'm sorry I could not get it in the PowerPoint. It was not working, but that is what I have for today. Very rewarding case. So if you have comments or questions or you're using this for credit, please do feel free to email me. Thank you to everyone involved in Echo's care. We had several rehabilitators, zookeepers, caretakers, wildlife veterinarians, and everybody, regular veterinarians who helped take care of him. And also donors. We had a lot of donations for him, whether it was food with like raw deer meat or monetary for his bedding and things like that, feeder rats. That was all super successful. And so thank you guys. We'll talk to you later.